A 50-year-old man presents to the emergency department with chest pain. He describes the pain as sharp and stabbing, and it is located in the center of his chest. The pain is worse when he takes a deep breath or coughs. He also has shortness of breath and nausea. What is the most likely diagnosis? Myocardial infarction, pneumonia, pleurisy, gastric ulcer. The most likely diagnosis is myocardial infarction. Myocardial infarction is a heart attack, which is caused by a blockage of a coronary artery, which supplies blood to the heart muscle. The patient's symptoms of chest pain, shortness of breath, and nausea are all consistent with a myocardial infarction. It is important to differentiate between myocardial infarction and other conditions that can cause chest pain, such as pneumonia or pleurisy. The treatment for myocardial infarction is to restore blood flow to the heart muscle. This can be done with medications, such as aspirin and nitroglycerin, or with surgery, such as angioplasty or coronary artery bypass grafting. A 30-year-old woman presents to the emergency department with shortness of breath. She has been feeling short of breath for the past few days, and it has been getting worse. She also has a cough that is producing clear mucus. What is the most likely diagnosis? Pneumonia, asthma, bronchitis, heart failure. The most likely diagnosis is pneumonia. Pneumonia is an infection of the lungs. It is caused by bacteria, viruses, or fungi. The treatment for pneumonia depends on the cause. Bacterial pneumonia is usually treated with antibiotics. Viral pneumonia usually goes away on its own, but may need to be treated with antiviral medications. Fungal pneumonia is usually treated with antifungal medications. A 10-year-old boy presents to the emergency department with a head injury. He fell off his bike and hit his head on the pavement. He is awake and alert, but he is complaining of a headache. What is the most likely diagnosis? Concussion, subdural hematoma, epidural hematoma, intracerebral hemorrhage. The most likely diagnosis is concussion. The patient's symptoms of headache and alertness are all consistent with a concussion. A 20-year-old woman presents to the emergency department with abdominal pain. She describes the pain as sharp and stabbing, and it is located in the lower right quadrant of her abdomen. The pain is worse when she moves or coughs. She also has nausea and vomiting. What is the most likely diagnosis? Appendicitis, gallstones, pancreatitis, kidney stones. The most likely diagnosis is appendicitis. The patient's symptoms of abdominal pain, nausea, and vomiting are all consistent with appendicitis. A 65-year-old woman presents to the emergency department with stroke-like symptoms. She has sudden weakness on the right side of her body and difficulty speaking. What is the most likely diagnosis? Stroke, transient ischemic attack, TIA, brain tumor, or epilepsy. The most likely diagnosis is stroke. The patient's symptoms of weakness and difficulty speaking are all consistent with stroke. It is important to differentiate between stroke and other conditions that can cause stroke-like symptoms, such as TIA or brain tumor. A 35-year-old woman presents to the emergency department with an allergic reaction. She has hives all over her body and is having difficulty breathing. What is the most likely diagnosis? Anaphylaxis, urticaria, angioedema, sepsis. The most likely diagnosis is anaphylaxis. Anaphylaxis is a severe allergic reaction that can be life-threatening. The patient should be given epinephrine as soon as possible.